Hi, it's Dr. Paul Goldberg of the Goldberg Clinic. I am here today for a follow-up examination with Mr. Dana Wilson. His wife Darla is down here also, and they are from my home state of Ohio. And Dana, you're actually from Waterford, Ohio, which is right near Marietta.
Yes.
So I used to go down through, I was telling you when I used to work in West Virginia. And Dana, tell our audience what you originally came to the Goldberg Clinic
with psoriatic arthritis, and had a lot of joint pain in my knees, hips, and feet.
Did you also, and if I remember this right, you also had gout? Had been diagnosed with gout as
Yeah,
well?
they diagnosed me with gout, and they kept treating it, but it was getting worse with the medicine that they was giving me.
Okay, so psoriatic arthritis, which can be very painful, and also with gout, which typically affects the lower joints, particularly kind of stereotypically the large toe of the foot, but can certainly affect the ankles and knees and other joints as well. How much of a problem was this for you?
I pretty much had to be on steroids just to be able to walk.
Okay.
Comfortably.
So you were medicated with steroids? Were there any other drugs you were on?
No.
Okay, so
well, the one was pink pill they gave for gout, but it wasn't working. I think it was pink or purple.
all right. So you were on medication for gout, and you were also on corticosteroids. You were on, was it prednisone that they were giving?
Prednisone and Kenalog.
Okay, cortisone and Kenalog. And how was that going for you? How many years had you been medically treated for this condition?
About 3 years.
3 years.
Mm-hmm.
Okay, and how was that going? Was it getting better or worse?
Getting worse.
Getting worse. Okay. And you came down here and you saw us, and you had done some of the things to help your health before. You had lost a lot of weight.
About a year before, yeah.
Yeah, you lost a considerable amount of weight.
Mm-hmm.
How much weight had you lost originally?
Originally, about 96 pounds. Since my largest, I was 272.
Yeah. And how much did you lose when you came? It's been about, we figure what, about 30-some pounds since you saw us?
Yeah,
additional
36 pounds.
Okay. Now, one of the things I want to get across on this video is that Dana's done a great job, and most of the success is due to him. And he's been following our instructions to the letter, working with myself and with Dr. Tenner. And there has been some ups and downs. We've only been working with you a little less than 3 months, and during that 3 months, did you just immediately just feel great and fantastic? No. What happened with you immediately when we started working with you, and this we had cautioned you was likely to happen?
Immediately, I was, as my body was cleansing out, I was going into a lot of pain, and that lasted for probably 8 to 10 days.
About 8 to 10 days. And so some of the joint pain, you already had a lot of joint pain,
Mm-hmm.
and some of that joint pain was actually exacerbated during that time.
It seemed to all settle on my left foot for one reason.
Yeah, and we have some pictures of how inflamed that foot was.
Yeah.
All right, and after that initial period, and of course you're getting off the steroids, you've been getting off steroids as well. And you're not on any drugs now, right?
No.
You're off all drugs now. And after that bad period, which we call having what we call bumps on the journey, your body, as you said, is detoxifying, it's going through that steroid withdrawal. What happened after that?
Pretty much now, I just have little bumps in the journey, and what I'll do is I'll just kind of fast when that pain comes up,
Mm-hmm.
and for like a 24 to 36 hour period, and it seems to go away the next day.
And so after the bad period there, Dana, did you get improvement after that?
Mm-hmm.
How much improvement have you had, percentage-wise?
Percentage, I'm at 90%.
You're at 90% better.
Yeah.
Okay.
Yeah.
And how are you feeling overall? Since we're not just treating your joints, but working with your overall health.
I feel clearer thinking, and
Isn't that interesting how when people get healthy, their mind clears up so you can think more clearly?
Yeah.
Yeah, as your disposition improved too? You already had a good disposition.
Yeah, I think so.
Have you noticed his disposition is more cheery now, Darla?
Yes.
Yeah. Okay. All right. So this is in less than 3 months, 90% improvement in your joints, feeling better overall, even including mental clarity. And now we're going to work on progressing even further. So we now want you to retain the improvement that you've had and make more improvement as we go along here.
Okay.
And by the way, are you not taking any drugs now?
No.
Have I prescribed any miracle drugs for you at all?
No.
How about, as I say, you take this miracle supplement, you're going to be better?
Yeah.
Not at all. Any miracle herbs?
Hello.
No. Just some hard work, some discipline, addressing the things that we found with Dana's biochemistry that are off, and we've had a good success. Thank you, Dana.
Thank you. Thank you very much.